we inhibit this enzyme, there is built up a bradykinin in the lungs, causing the so-called famous dry cough of ACE inhibitors. It can also cause rash, and in some occasions also can lead to angioedema of the airway. So we have to be careful when this happens. And as I mentioned before, because of aldosterone system is blocked a little bit, so thereby can cause hyperkalemia. These drugs are known to cause refractory hypertension during general anesthesia, and which will not be responsive to your conventional vasopressors like phenylephrine, or you may have to give very high doses of norepinephrine or so. So for this refractory hypertension, it is nowadays recommended, and it is in the guidelines, that these agents should be stopped at least 24 hours before surgery. Coming to angiotensin receptor blockers, they end up with sartans like telmisartan or losartan. So these are again very effective antihypertensive agents, but they can also lead to refractory hypertension during anesthesia. So again, similar to like ACE inhibitors, they should also skip the morning dose. So the last dose should be a day before, not on the morning of surgery. Calcium channel blockers again are very popular and commonly used agents for hypertension.